I've become pretty obsessed recently of trying to conform most of the work that I'm doing to international standard and classification systems. And recently I was looking for a list of all the healthcare occupations or roles in healthcare jobs, and started to compile this myself and then realized, well, this must exist elsewhere. And so what we're going to look at today is the ISCO 2008 International Standard Classification of Occupations and the WHO International Classification of Healthcare Workers. And very briefly, a little backstory on these two documents. And then critically, what I've done is I've reformatted the WHO document out of an inflexible PDF format into a spreadsheet that you can download if you want this type of a document available. And so when you look at international classification standards for occupations, the really big document to turn to is one published by the ISCO, which is the International Standard Classification of Occupations. Now, this organization is this document is part of the International Labor Office, which in Geneva is part of the United Nations. And the most recent publication of the ISCO is from 2008. And there's a link here to the 2012 edition of that 2008 publication. So that's the ISCO-08. And ISCO initially was talked about way back in 1920s when they first started discussing the need for standard classification of occupations, and then the first formal classification systems came out in the 1940s. And one of the benefits of having international classifications standards for occupations is the ability to share statistical data on global labor markets and workforces between different countries. This type of a classification system is also useful if you're in a country or a region which doesn't have a particular heuristic or classification system that they use for occupations. But it's important to realize that this occupation classification system is not designed to group people based on legal identity or regulatory nature of these different professions. And so this is a 400-page document. You can get to their original ISCO website linked through the blog post. And as you can see, there's a section inside of here, Submajor Group 22, which deals specifically with healthcare professionals. And then within that, there's multiple minor groups which go through more details as far as what quantifies someone to be a general medical practitioner in unit groups, and then they provide some unit group examples. So that's kind of the core fundamental document that I was able to find as far as ways to classify occupations, specifically in healthcare. Now, there's one other document which builds on this, which is from the WHO. Now, what the WHO has done is they've published a international classification of health workers document. And as you can see, the first sentence says that this document is, quote, largely based on the International Standard Classification of Occupations, 2008 revision. And so it's not entirely clear the difference between the WHO document and the ISCO document. From what I can tell, the WHO document does insert the ISCO codes in their occupational groups, and seems to be, for the most part, pretty in line with the ISCO document. Now, from what I can tell, it's unclear when WHO put out this PDF classification, because the date of publication is certainly not on the PDF, and it wasn't very obvious on their website either when I was looking. Now, this is not a very usable format, this PDF document, and so I looked for an Excel version and managed to find a 2010 document from the WHO, which was an Excel sheet. And it looks like this was initially designed for nations and regions to be able to submit data to the WHO. And within that Excel sheet, they had what looks like the PDF we saw on the previous screen available in an Excel format. And so what I've done is taken the PDF from the WHO, which is based on the ISCO classification, found that PDF in an Excel format, and then taken the examples that they provide for each particular occupation, and rather than having it as a large block of text, as you can see on the screen here, where they just list those particular occupational examples, I went in and segregated and divided it line by line. And so here we have the ISCO code, we have the sub-minor group, we have, the sub-major group, health professionals, we have the minor group, medical doctors, we have the unit group, generalists, and then we have examples of generalist medical practitioners listed underneath. And this now is in a usable format if you want to ingest it to some other system, or if you want to filter it on your own. As you can see, it goes on for quite a length. There's actually, from what I can tell, approximately over 50 different major groupings of healthcare workers, and there's at least 300 examples of healthcare workers. Now, not every single healthcare worker is inside of this document listed, and so I've copied this into my own tab, as you can see here, called tab 2, Complete Healthcare Roles List, where at the bottom I just add, as I come across, worker roles which are not mentioned explicitly in the examples above. And so when I have time, or when someone else has time, they can go through and essentially take these non-listed roles, figure out which of the ISCO and WHO classifications they best fit in, and then insert those examples. On the website, you can see that there's screenshots related to this underlying spreadsheet, and if you want, you can download the spreadsheet which you've been looking at, available at this link here on the Google Sheets link. Now, of course, a document with over 380 lines is very difficult to view as an overview if you want a general gestalt of the different major headings of healthcare worker roles. And so there's a few ways which you can look at major classifications. Again, if you go just to the ISCO international classification or to the WHO classification and you leave out all the examples, you are left with the document as you can see here on screen. And this is actually quite a reasonable list. It's probably maybe about 50 lines long, and it shows the major, sub-major, and sub-minor groupings with the unit groups underneath. And so this is a digestible way to see an overview of all the different types of professionals inside of healthcare, and non-professionals actually, and support staff. There's another way which you could try grouping health workforces, and on another part of the WHO Health Workforce Statistics, they list the Global Health Observatory Data Repository. And this data, there's two different ways they present the data, both in aggregate data categories and in disaggregate data categories. And you can see here the major categories for their aggregate data: physicians, nurses, dentistry, pharmaceutical, lab, environmental, public health, community, traditional health workers, other health workers, and healthcare management and support. And there you get a very high-level groupings, but it's very easy to see because you're only looking at approximately 9 items. And here in the disaggregate categories, we have slightly more categories and examples provided underneath each of the categories. So if you're looking for, again, a very high-level overview, this would be another document you could turn to. WHO also categorizes sometimes based off the educational categories. So there's a link here to the initial document that this originates from, but it's another way to try to classify healthcare workforces. Again, if any of this information seems remotely useful to you, you can download the Google Sheet, the link on the blog post, and this is at least a way to think about linking the way perhaps that you control healthcare worker roles inside of an electronic medical record to official international standard classification system. So if you're thinking about the different ways which you may want to name roles or structure roles or aggregate roles, this is some well-regarded and widely used standards to do so.